Good morning. This is Dr. Rutledge, and we're going to talk today about the terrible pandemic and the damage it causes to people and countries from diabetes. And if any of you who know me know that we're going to talk about the solution. So 1 second while I share my screen. And we'll get started. Okay, this is the crisis in India we'll be talking about, but it's all over the world. America has a 10% rate as well. We're particularly worried about the most tragic complications. You can have diabetes and live in many ways a normal life, but these are the four that I picked out to attack, to defend against, and that's blindness, kidney failure, amputation, heart attack, stroke, and death. And we'll talk a little bit about that, but also I think we have the solution, which is a very radical statement, but those of you that know me are maybe not surprised. Here's the outline. We're going to talk about just very briefly the diabetic pandemic. We'll talk about these four terrible complications, and particularly as number 3 here says, we're going to find out that we can figure out who's at risk. In other words, if you have a very low, slight amount of diabetes, I think you should fight like a tiger to get rid of it. But maybe it's not as urgent for someone who has a higher level, because the hemoglobin A1c is a predictor of doom and gloom and potentially blindness and death. So we want that to be made very clear. Then we want to talk about drugs, and we have a lot of drugs. And it turns out that they only change this measurement, the hemoglobin A1c, by 1 to 2 points, and the majority are around 1. And in many cases, if you have a hemoglobin A1c that's a high like 8, 9, 10, 11, or in the teens, a change of 1 is helpful, but not as much as we would like. So then we want to bring up the question of what can be done. And then we want to point out this old doctor, Billroth, has created an operation that's been used for a long time. I used it in the making of the MGB. And we have new data showing that a Billroth 2 operation on a thin diabetic causes reversal of diabetes in a large number of patients. And so that's very exciting. And we happen to have the Billroth 2 available, especially in the new version of the MGB, the MGB2, which has a lot of advantages. It's safer and less expensive and outpatient. And so there's a lot of exciting things to talk about today, I hope. So first, the pandemic, we're not going to spend too much time, but 317 million diabetics, 10% of the population in India, similarly 10% in the United States. So this is truly pandemic level. The terrible thing is it's not just a mild disease, but it can be devastating. And that's just a horrible thing to think about. Blindness, kidney failure, amputation. And we see some of the numbers here, 25-fold higher risk of diabetes, of blindness if you have diabetes. It's devastating. And so what we'd like to do is say, we think we have a solution. Okay, first of all, we need to know who's going to get it. Not every diabetic is about to get it. Maybe not everyone is going to need surgery, but we think the high-risk people in particular should be warned of the dangers. Notice that the drugs are not being very effective. We just saw 3 people in clinic yesterday. All were on maximum treatment, including insulin, and all still had hemoglobin A1Cs between 8, 9, 10, 11, and 12. No? No. So hemoglobin A1c is a sign of whether it's the devil at your shoulder or the angel. The hemoglobin A1c tells us, for example, high is bad and higher is worse. Low or normal means a low risk of complications and death. And so let's talk about that a little bit further. So here's diabetic complications. And so hemoglobin A1c greater than 7 increase the risk of heart disease, kidney disease, nerve damage, and blindness. Medium is only moderate risk, and less than 6, that's a relatively safe zone. We know that hemoglobin A1c reflects the average blood sugar over time, and extensive research shows a strong correlation between hemoglobin A1c levels and the rates of severe complications. How can we use that? If we can't get it under control with diet, exercise, and drugs, then we need to do something else. And we have something else, and we'll talk about that. What about medicine? We got drugs, don't we? Well, the bad news about that, they only change it by 1. So if you have a hemoglobin A1c of 12 and you make it 1 or 2 points less, you're still in the danger zone. And so that's a very important point. So here's an example of the average delta hemoglobin A1Cs. You can see metformin, sulfonylureas, even down to the GLP-1 drug, not much of a delta or change in hemoglobin A1C. That means you can't rely on medicine if you have a very high hemoglobin A1C. Also, it costs a fortune. So if you look at the cost for insulin and GLP-1 agonists, it's very expensive. The MGB2 is short and simple and only a tenth of these costs. So much more effective and much, much less expensive. All right, what can be done? Let's talk specifically. Well, there's this devastating worldwide epidemic. Drugs are expensive and weak. And the answer is we now know from a lot of old studies, and that's the Billroth 2 surgery. So we want to try and explain that to you. Billroth 2 was the father, many people say, of the abdominal surgery in 1881. And we can now show that we can reverse diabetes with a Billroth 2 operation, which is pretty exciting. Our new version, Billroth 2, is shown here in this example. Dr. Kular and I were working on a project of analysis of his data, and one of his patients from about 10 years previously called. He'd had a post-operative, or he is now post-MGB2. Sorry, post-MGB. So pre-operatively, Dr. Kular looked up his data. He had a hemoglobin A1c pre-op of 14. Now, we asked his doctor, what his doctor said is now his hemoglobin A1c is 5. In fact, he had even forgotten, he said on the phone, that he was diabetic. He's 10 years ago, he was diabetic. And 10 years without diabetes because of the Billroth 2 MGB. And similarly, MGB2. Now, 10 years post-op, normal hemoglobin A1c. So we would suggest, we can't say for sure, we may have saved his life. You may have saved him from a life of blindness and heart attack and stroke and kidney failure and amputation. That's what we're talking about today. All right, well, what exactly is a Billroth 2, MGB, MGB2? Well, basically, the normal stomach, as you can kind of see here, there's the esophagus, the stomach, and it usually goes through the end of the stomach, the tip of the stomach, the lower outlet of the stomach called the pylorus. And then it goes into this location up here, which is the beginning of what's called the duodenum. This operation, the Billroth operation, is done for lots of people who are not obese or having obesity surgery. Although I have adapted it to the MGB. But so what it means is if you had an ulcer, for example, or if you had gastric cancer, sometimes they will just cut out this piece of the normal tract of the stomach. So this will not get the food anymore. That's the duodenum. And instead, it will be dumped directly here into the proximal jejunum. That's what that part of the small bowel is called. Now, when that does that, instead of the food normally going to esophagus, antrum, that's the missing part here, then to the duodenum there, and then down to the jejunum, the Billroth 2 changes it. It just jumps, skips, and it goes directly into the small bowel. And that makes all the difference. So let's talk about Billroth a little bit more. We now know that if you do something like this does the same thing. So it takes this, and you can't deliver the food because of this plastic container. So it makes it just like the MGB. And when it does that, it cures diabetes in the mice. So another study showed that Billroth 2 improved diabetes HbA1c levels by 82% and resolved it in the other 22%. So minimal weight loss. So in other words, it's not weight loss. So everybody says, oh, you can't do, no. This is an operation that's done for non-obese patients, and it routinely causes resolution of diabetes and reversal in many cases. Not all, but a lot. And it's certainly stronger than a pill. So Billroth 2 improves diabetes with minimal weight loss. That's a study just done in 2012, and there's lots more like that. So let's look at the MGB itself. And basically, here's studies from Dr. Kular, and this was 570 patients followed for 10 years. Now, if you look on the x-axis down here, there are people here with hemoglobin A1Cs way in the danger zone. Okay, these people are at high risk of those complications we talked to. And look what we did. Here's the post-operative 10-year data. Not everyone, but almost everybody's below 7. So danger, death, blindness, heart attack, stroke, or safety. And that's all from the Billroth 2. So here's another study, Billroth 2 in non-obese diabetics done in 2004. The Billroth 2 resulted in long-term treatment of diabetes, control of diabetes due to duodenal jejunal bypass. And this is a study by Dr. Rubino, and he concluded that the results showed that a bypass of the proximal duodenum and jejunum alone can directly control type 2 diabetes in this animal model. And it's been then shown in numerous other human studies. So numerous general surgery studies show, when done for other reasons, that Billroth 2 has a very high rate of reversal, including an improvement of diabetes. So here's a giant study on the country of Taiwan. They looked at everyone in the country, a population-based study. So everyone's included. And they looked at the risk of diabetes in those who had a Billroth 2 for peptic ulcer disease or those who did not. So they had a large sample size, so it's much more likely to be telling the truth. And what they found is that Billroth 2 in 662 patients versus controls in about 2,600 patients, that the Billroth 2 patients had significantly lower diabetes rate. Diabetes cut in half. Diabetes cut in half. 6.7 versus 13 cases per 1,000 patients. So the patients who had a Billroth 2 cut their risk of diabetes by 50%. Billroth 2 patients had lower rates of other comorbidities and reduced risk of diabetes and complications as measured. And here's a picture of it here. So that if you want to avoid diabetes, you can do a lot of things by eating healthy and things like that. But worst comes to worst, and you're looking down the barrel of a high hemoglobin A1C, I believe we now have a suggestion we might have a reversal in the future. This is the MGB2. It's like the MGB. It has a narrow stomach pouch. No staples are used, so there's less chance of bleeding and leak. It's less than 30 minutes. It's same-day surgery, and it's less than half the cost. And more details on that upcoming. But imagine an MGB2, a new hope for diabetes management. There's a diabetic crisis right now. And what we know now is that Billroth 2 decreases hemoglobin A1C in 90% of patients at 10 years in our experience. We think we should advocate for diabetics' access to the MGB2 and create a future where we decrease the burden of diabetes on these unfortunate patients. Thank you all for watching. That was a draft.